Today, let's talk about 1 year clinical outcome of dual antiplatelet therapy with the novel Ticagrelor plus aspirin versus Clopidogrel plus aspirin for endovascular intervention of patients with intracranial aneurysm, a meta-analysis. The use of stents to treat un-ruptured intracranial aneurysm was first approved in the year 2002 in the United States as a Humanitarian Device Exemption. Antiplatelet therapy is mandatory following stent placement. Dual antiplatelet therapy with aspirin and clopidogrel has been the first line agents for the prevention of thromboembolic events following neuro-endovascular procedures. However, clopidogrel hypo-responsiveness has often been observed. In this analysis, we aim to systematically compare 1 year clinical outcome of dual antiplatelet therapy with the novel ticagrelor plus aspirin versus clopidogrel plus aspirin for endovascular intervention of patients with intracranial aneurysm. Coming to the methods, on electronic databases were searched from June 2023 till July 2023 for relevant studies which compared dual antiplatelet therapy with ticagrelor or clopidogrel for endovascular intervention in patients with intracranial aneurysm. The endpoints which were analyzed were classified into thromboembolic and hemorrhagic events. A fixed and a random effect statistical model were used during data analysis respectively. Risk ratio with 95% confidence interval was used to represent the data following analysis. Coming to the results, 5 studies with a total number of 893 participants were included in this analysis. 358 participants were assigned to the ticagrelor group, whereas 535 participants were assigned clopidogrel group. Participants' enrollment period ranged from the year 2009 to 2019. The results showed that during a mean follow-up time period of 1 year, dual antiplatelet therapy with ticagrelor was associated with significantly lower thromboembolic events with risk ratio of 0.33, 95% confidence interval 0.16 to 0.68, p-value was 0.003. In addition, at 1 year, dual antiplatelet therapy with ticagrelor was not associated with any increase in hemorrhagic events when compared to dual antiplatelet therapy with clopidogrel. To conclude, at 1 year, dual antiplatelet therapy with ticagrelor was associated with significantly lower thromboembolic events without an increase in hemorrhagic events when compared to clopidogrel associated dual antiplatelet therapy for endovascular intervention of patients with intracranial aneurysm. However, even though ticagrelor associated dual antiplatelet therapy use appeared to be more effective and safe, this hypothesis should only be confirmed in larger upcoming trials.